hopefully to help us answer some of the questions. Don't feel like you can't express yourself. We want people to express themselves. We're not telling you go get vaccinated. We just want to know people's views about vaccination, and so we can actually sort of like help NHS, communicate better with members of the community. So I'm going to pass you guys over to Kingsley. All over to you, Kingsley.
No pressure at all. Anyway, right. Basically, we're just going to have a few questions about the COVID and who are taking the vaccine and those who haven't. So we're going to have 10 questions here. So we're going to go through them individually, just over hand. If you have, why? If you haven't, why? So time is of the essence, so we haven't got that much time. So what I'm going to ask first of all, thank you in advance for taking part in this. It's quite important, really, for the NHS also to gauge our thinking around this COVID. Whether we like it or not, it's still here. It hasn't gone away, although it's not as prominent as it used to be. Right. So, have you taken COVID vaccines at all? Any? Yeah, we show hands.
I have taken 3 doses.
Okay, if you have how many? 3 doses? Yeah. Okay, so pretty much most people.
Has everyone not had any vaccines at all?
I was going to come to that, but okay, yeah. So you haven't had any vaccines, you haven't taken one?
Well, I booked an appointment and I forgot. I forgot to reschedule it, and then by the time I realised, I just couldn't.
So you had an intention to have it done, really? Okay, that's fair enough. And you're 18, right?
Yeah.
Okay. Yeah, the youngsters usually think, tough and not gonna. Okay. Anyone else who hasn't taken the vaccine at all? No. Good. That's good.
So the question really is, if you have taken the vaccine, what made you take it?
Yes, that's how I was gonna pick on individually.
Okay.
I'll go with Barryman first. Why did you take the vaccine?
My safety and my family's safety as well. Okay. And I took my first one in school, I think, so it was like a joint decision with my mum, and she made sure it was my choice, and I just agreed to take it.
Good.
I took it because I wanted to travel to see my family.
Oh, right. So if it wasn't for travel, you won't be taking it because you needed to.
No, but I wasn't sure if I would take it if I was needed to go to see my mom. So I didn't regret that.
Okay. So what is your perception of the whole vaccine? What would you say your thoughts are concerning the vaccine? Do you have any concerns about the vaccines or not?
Because I never took vaccine before.
Right.
So I don't know because if I need it. Yeah.
If you need it. That's what I'm trying to say. So it's been imposed on us. Do you feel that actually it's a good idea? Because for me, I tell you, my perception of the whole vaccine is that, for me, I think it was safe because a lot of tests were done. Although it was done in record time, if it wasn't for the vaccine, we would have been in a much worse position than we are.
Yeah, because for me, I was confused because the vaccine, on my point of view, is to prevent. But the people who was taking the vaccine, even they were already infected. That was confusing for me.
I think Barney said, okay, it's understandable, but it wasn't 100% proof safe. There wasn't even any indication. It's not 100% proof. And if you look at when we saw all the charts and everything, all the different companies from Pfizer or Moderna, some of those says 70% or 80% security, which is better than nothing at all. So anyway, that's my thinking of it. Some of them were.
Me personally, I took it because obviously, I've always been educated around vaccines anyway, because they've always taught us in school the benefits of them, like herd immunity. If majority of people are vaccinated and they're immune, you're protecting the minority that maybe can't be vaccinated because it might have health effects on them. Some elderly people can't take it because they get quite sick from the vaccine because it is a virus that obviously you know what I mean, it's a small bit of the virus that they've used so you're immune to it in most cases. And I've always had all my vaccines anyway, so I've never had them demonized in my head like propaganda, what's been posted on social media and stuff. So I've always thought they're fine and they're safe because I've had them from a young age, and so. And they actually asked you a lot of questions. Like there was a screening process before you got your vaccine to see which ones might be suitable for you, or maybe it's not suitable for you at all if you had health conditions.
Yeah.
So I think that's why it was safe.
Okay. Don, you got your hand up.
I had all my vaccines, but with the last two, I'm not saying it is connected, but with the last two, one I ended up in hospital for a week straight after having it with a really bad lung infection, and the last one I ended up in hospital with an incredibly bad chest infection. So I'd had COVID before I'd had my injections, and I didn't want it again, and that's why I had it. But I'm now not sure whether I would have it again, because I'm scared that I'm going to have that over a week in hospital if I have it.
Yeah. I'm not a medical expert in any way, shape or form, but I was quite glued to the telly all the time when they were giving information about it, and that there will be 1% or 2% of people who have side effects. It may be the same in your case. Frankly, whatever medication we have, some people, there will be some side effects, not everyone. Unfortunately, you may be one of those, but I'm not a medical expert, so I wouldn't know. But there are side effects to almost every medication, because we are different people, different genes, different backgrounds, so...
And I am on, to be honest, I'm not sure whether, again, it's the fact of, like you say, there are side effects, and I'm on quite a few other tablets that it could have had a, caused it mixed with, but it has, I believe we should have all got vaccinated. Like I say, I got vaccinated after having it because I had another week in hospital with it, and it is the more people that you can get vaccinated. I don't believe it, but I'm agreeing with this young man. Like the herd vaccination, that the more people that have it, you can protect the ones that for some reason or another can't.
Okay. We've got Martina, do you want?
I had the vaccine quite early because I was a key worker, so I didn't have many choices to take it or not. And because it was really early back in the day, I didn't have much information about the secondary effects, but I never thought I'm not going to have it because, as Aidan said, I understand the importance of having the vaccine and I wanted to protect everyone else. I think my biggest concern was the lack of community with the rest of the world. Like every country was doing something completely different, depending on if they were left or right politicians, and that made me feel really unsafe, because if everyone is doing the same, I would jump into it. But seeing that every country made the decisions they wanted to, and they changed it from one week to another, when you can see 6 people and now you can see 25, and then next week you're going to be 6, that made me feel really unsafe. So it's not about the vaccine, it's about the whole COVID situation. I think the repercussions as well, we're going to see a lot of children that they stop going to school, and all the mental health issues that we made with that decision. I think we're going to still see it for a very long time, and I think the damage of the decisions, the poor decisions that the politicians made, is going to be quite big in a couple of years. And because obviously for abuse and stuff like that, the first point of contact is the school, community services and hospitals. If you lock off of that, you leave a lot of population without any supervision. So I think the consequences are going to be quite bad in mental health and...
Okay, now some of the questions I've already answered with regard to how many vaccines people have taken. I think most people have taken 2 or more.
I did 3.
So, yeah, I think everyone who took it, has anyone just done 1 vaccination, or you do more than 1? Yeah, most people.
I think what's also really important here, because we've got a lot of people here with different rates, and is the message that get cascaded out to these respective groups. I think that's really important, because we're all part of a circle of groups, and it's important to sort of like, because people talk to us on a daily basis, and to listen to those people's views and then why they're not taking the vaccine, I would say. And then to see the information that they're giving us if it's a valid reasons why they're not taking the vaccine,
Yeah.
and see how we can, because the reason why I took the vaccine is we were helping a lot of people in the community as urbans. We were delivering food, we were sort of like supporting a lot of people, and to me it was I didn't believe the vaccine to start with, but because I wanted to protect other people, and then I went on to take it. So a lot of people took the vaccine without believing in it, or they wanted to travel, they were coming, close contact with people. But it's just kind of like the whole thing, what are those people around you saying?
Yeah.
And then how can the NHS really improve their communications to members of the community?
And I think that's key there, what
Yeah.
you picked up.
Yeah.
Exactly.
Is, my role is health and equality, so this is part of parcel of what I do within my role. I'm not clinical,
Yeah.
so don't provide a lot of questions. I probably won't be able to answer those, but I can certainly understand why these things have come about. So we know COVID was one of the first sort of things that highlighted the inequalities.
Yes.
So a lot more Black, Asian
Yeah.
people died in COVID
Yeah.
than white British. So why is that? And then subsequent to that as well, a lot more people from these communities didn't take the vaccine. So even in Portsmouth, we have
Yeah.
huge disparities. Black African and Asian communities took the COVID vaccines less. Why is that? Maybe some of the public messages that went out didn't go out in the right ways, didn't get to were delivered in a way that wasn't appropriate to those community groups. And certainly from the community that I'm from, there were lots of things on YouTube, on social media, lots of conspiracy theories, and that really made people question whether they want to take the vaccine or not. We know that taking the vaccine doesn't stop you from getting COVID.
Yeah.
You'll still get COVID, but the effects of that will be a lot less.
Exactly.
So you're more likely to survive from a huge, from that. But I think it's that mixed messaging, public health messaging that didn't reach our wider communities. And that people really had these horrible theories that actually, the thing that you picked up as well, Kingsley, about how fast, usually it takes years for vaccines to be developed, and suddenly you've got this, almost like within a couple of months, this huge, new vaccine that's come out. Have they tested it on people? How do they know it's safe? So, all these things raise concerns and worries. But when you think about it logically, this is a global effort. It wasn't just one country with a small bit of funding. This was a global effort to get this vaccine together to make sure that it combats, COVID. So that's, for me, gave me some reassurance so that I can go out into communities that actually know it wasn't just a small pot of funding. A global effort to make sure that everyone had this. But certainly for me, it was the messaging that was wrong. And that's where a lot of our communities who are frontline workers, who do those things, suffered more with fatalities in different areas as well. So it's about, I suppose, how do we tackle that? So if something happens in the future, we know within our communities, this is the message that we need for our communities.
I think in talking about the messaging, because a lot of people from the minority groups, because English is not their first language, they find it difficult to sort of like read flyers. And I think the NHS needs to sort of like, that's the conversation that we're having at the back. Can you sort of like provide a leaflet in different languages? Because I think just kind of like, or we spoke, talking to our young people a few weeks ago, we spoke about TikTok, using all these different platforms to be able to effectively communicate with people in the community.
I think one of the key things of that is when we're here, we're able to take part in activities, understand what's being, asked of us. It's actually then taking that message back to the communities. Often the last thing we want is to come out and talk to people who are leaders of groups, who see a lot of people in their day-to-day, but they don't pass that message on. So actually do it as a sort of a duty upon yourself and for your fellow community to say, well, actually, I've learned this today. I'm going to share it with 3 other people, or 4 other people within our next group setting.
Absolutely. This is one of my passions because obviously I belong to the Ghana Association. I've been part of the executive members for God knows how long. And one of my passions is the fact that you come here, you gather all this information, really good information, fundamental in fact, to pass out to our communities so that they can understand. Unfortunately, some of past people have not done that, and I've been at loggerheads with them. If you know me, when I'm passionate about something, I want it delivered. So people, it's not about me or even those who are here. The majority who needs is the most. Fat was mentioning about a lot of misinformation about the COVID in our platforms that I belong to. The Ghana platform, there's another one I belong to, and there was so many miscommunications going on that it was actually disturbing. This is why part of our community were not forthcoming in terms of taking the vaccines. And I think now that we've established this, for me, I for one, I strive to make sure that our community, there's a representation, if you like, in what's happening at the top by consulting us. And if we get opportunity to be consulted, we need to pass it back so that our voices can be heard, so that something can be done about it. So it's up to us here, anyone who's here, who's in the minority and the majority, in fact, you know, we need to pull together. When something like this is organized by Airborne, you know, we are very lucky in a way. This Airborne has been, this was not part of Airborne's plan before, but now it's part of it. We need to make sure we talk about it to our own people, because there's so much that we are missing. More importantly, that we can contribute to make a difference for our children. So it's really, really, really important that anyone who's here, whatever we discuss here, this is only one topic. There are several others that we go through all the time, that we need you to be available, answer the questions, go to workshops that you delivered one on Tuesday, or something like that for the employment one, NHS employment thing. You know, things like this that our people could be aware of, so that it will absolutely help us. This is about communication, guys. So let's just make sure, whatever our understanding is with COVID, we need to nail it and speak to people. That it's important that we feed back the information so that decision can be made for the betterment of our community as well as the general public.
I think the government has to do a whole lot better.
That's what I was going to say.
The government has to do, because I was really worried at how quick the vaccination was put together, and again it comes down to our bond until, I forget who it was who came in, but till you had
the lady.
Until we had someone come in and actually say, well, this is what happened. We actually had sort of like the basic materials for the vaccination there first. I didn't know, because every time I listened to the news, the government had said something so totally different to what they said the day before or the hour before, that it wasn't until I came here that I understood a whole lot more. And then, like you say, passed it on to other people what I'd learned through that. But again, it does come down to, doesn't it, that a lot of it's not done. It's all done in English, or a lot of the time, and if English isn't your first language, then it's not very good. If you have on the bottom of the leaflet, if you need this in another language, please ring in English. You know, things have got to change that way as well.
I just want another question about COVID itself. Has someone here had a relative, a family member, whatever, a friend even really been affected, or even, you know, severely affected by COVID? Anyone here?
I have a colleague. A colleague at work.
Right.
She was really sick with COVID. For over a month she couldn't come to work. Yeah, I think she's still traumatized by it.
I know someone who had long COVID. Like they got it and they weren't really affected by it at the time, but then like over time they used to be very active, but now they can't do like more than like 30 minutes of exercise without just being really tired. And like they're just tired all the time now as well.
No, I was scared because I was in ICU for 3 days with my COVID, and it was just the most. It was my worst nightmare. There was always in my head. I always had the thought, especially when I was in the ICU, oh, you're going to die.
You were in ICU.
And then in my head, I thought I was going to die, but also in my head was, well, no, I can't die because I have far too much to do. You know, I had both of them going in my head, but it was none of my family being able to come and see me. Only as gorgeous as the nurses were going through that, I could have done with my son coming up and saying, putting his arms around me and saying, Mum, you're going to be all right. You're too tough to not be all right, which is what my son says all the time, you know. And it was the solitude, even though everyone who I saw there was so kind and so good at what they were doing, it wasn't family, and that's still sort of in the back of my mind nowadays with it.
Malaka, you had your hand up?
Yeah, and my stepdad's mum actually died from coronavirus. Back when it was a major thing. So, yeah, that's all my family had disability.
Interesting.
And also people being affected a lot about the vaccine in France or Belgium, in other countries. We saw that in TV. Some people become disabled from it. I don't know.
I think, yeah, this is all due to the side effects, and we mentioned about side effects, and frankly, and again, I'm going to give one of the answers to that is actually what I've seen from a doctor talking that normally, if you take a normal, if you're ill and take normal medication, the paracetamol, there'll be about 1% of the population who will be affected. So if you look at the vast majority who are taking the COVID vaccine, proportionately, 1%, even by law of averages, means that because we are all different genes, it means that there will be some people who will be severely affected just by that alone. So that doesn't make the vaccine unsafe. Does that make sense?
Yes.
You know what I mean? Yeah.
When I have my booster, I started having neck pain. That is pain me for over 3 months before they give me antibiotic. But I have a colleague have no here since she have booster, the side right ear is not hearing.
It's a different story, but again, like I say, it mustn't stop us from thinking. We all have different illnesses. You have to be unlucky to have that, but like I say, it shouldn't stop us. The vast majority, we're talking about, most people will be fine. And this is another reason why the vaccine is there, so that those who have got these certificates or who are, they call them vulnerable with different other illnesses. Malaka here with my son is got asthma, for example. And funny enough, I think are you the only one who didn't get it in your house? The only one who didn't get COVID in his household.
Oh, that's lucky.
And all his siblings had it, which is, yeah. I have to say, I haven't had it yet. He hasn't had it twice.
Me too. And my family never had.
But sometimes you probably have it and you don't know, right?
Twice.
But with
I had in the beginning. I didn't know it's COVID. That time COVID. People used to start.
Yeah.
I feel very ill. I feel tired.
You get it.
But I had the second one because I have the vaccine. I didn't. It's not affecting me. It's not making me
Exactly.
tired.
And this was this is what the vaccine was being pushed so much, because if you do get it, in the majority of cases, it's not as severe. It doesn't completely, and I think people's perception most of the time was if you have the vaccine, then you're not going to get COVID at all. But that wasn't what it's meant for. It was to reduce severity if you get ill or something like that, which I think from that you can back that.
is it to boost your immune system or something like that?
Yeah, but more importantly, to really not for the COVID, the effect of you not to be as severe. And I think it was mentioned that from that point of view, it worked. Does that make sense? Yeah. Pardon?
I said me, I felt sick.
When you took the vaccine?
Yeah, no, shivery till now. Got colds all the time.
Really?
My body feels shivery.
So when you get the flu, when you take the flu vaccine, there's
Everything-
always side
everything
effects.
changes,
Yeah,
like-
so there's always going to be something.
Yeah.
And I think one of the things that we struggle with here within health services generally is our lack of data. Our lack of data around our different community groups.
Yeah.
There's a huge disparity when it comes to research. So when they're doing research, people that get involved in research are from particular communities. So it's all based on that community.
Yeah.
And actually, if we don't involve ourselves into these research, these trials, then we're not going to get that different results. You know, there might be something, you know, with certain community groups that affects them very differently. But if we're not putting ourselves forward and saying, actually, you need to come and talk to us, you need to come and research our community, you need to come and do clinical trials with us, that data will always be a bit skewed. Yeah? So there is a huge research team at Portsmouth Hospitals, huge. There's lots of research going on all the time, hundreds of research, but when they want to get people from communities to engage, it's usually white British, middle class, affluent people. You know, so all the data is around this big community and not our small.
I and my kids were elected to do, I don't know, I think it's a trial. We were paid in every test they collect from us, they pay us money. So I didn't hear any.
The research back.
Sorry?
You mean the research?
No, yeah, no, the results, I always know that it comes out like positive, negative, that we don't have the virus, but we've been having the test for more than, it's a trial. I think it has to do with our immune system, or to check the virus in our blood. Yeah, so it's unfortunate that none of us have the virus, but they keep doing it for more than 6 months.
Sometimes we never put ourselves forward. Anything to do with trial or even researches, we are the very last people to put ourselves forward. For whatever reason, I don't know. And
I was a bit skeptical when I got the letter, and I'm like, I asked my children their view. They said, Mom, let's just try it. So I just took part.
So I just said, this is why, like you were saying, there's not enough information for trials to really establish if there's any patterns within our communities, if there's anything like that.
And sometimes misinformation can...
That's unfortunate. That's right.
Yeah, when you give the wrong information out.
Because some people, there's so many
scared
things.
Some people to take part, I think my personal view is for the NHS to get into the community, because within the community you have different groups from different countries who have different cultures and beliefs and taboos and stuff like that. So for minority groups to understand more of how to handle the situation in terms of, especially during the COVID, like coming to the group, talking to different groups of different ethnic minorities. Then from there, those groups would sensitize within the community as well. So it's like...
So you're like, so you believe that building their trust, you can then, because they've got the trust of their group.
Yeah, because when you said come into the group, it's not everybody is going to be there with the NHS staff. So having them to see the group, and then within that group, you sensitize. It's like a tree with branches. Then you sensitize different people, being it on WhatsApp, being it online, on posters, and at school as well. I think they should be like sensitizing in primary schools and secondary schools. Because my kids during the COVID, they were like, we're not going to take the vaccine. And I'm like, why? They said, oh, you see, Mom, they said on social media, especially black men, when you take the injection, you'll be impotent.
That's what they did say.
And my son, like, you are 11 years, why would you have that in your mind? Why would you? He said, Mom, I want to have kids. And I'm like, okay, yeah, you have a point, but it's not coming from the government. It's like people are just saying their views. So you don't know who to believe, and So, but my friend, again, she contracted the virus, and she was really, really sick. She didn't want to be admitted to hospital, but she was at home, isolated, with her 3 kids and the husband for over a month. So when she came back, it's like she changed. Her personality changed. Everything about her changed. It's like, before we, as staff, we eat together, we do things together, but it's like she doesn't want to do all those things anymore because she's kind of traumatized, what she's gone through.
Even to this day?
Yeah, even in the house, it's like the family was like not close to her because she's had COVID. Even though after she was tested negative, it's like people were still giving her distance, like isolating her.
The thing is, I think it's a bit poor.
Okay.
Because when you call, example, the doctor, even appointment now, they give you a link. They ask you to use the link for appointment. While you already stay in the phone for half an hour before reach your own GP. Before, NHS is very good. After COVID, they still acting like COVID. That's what I understand. Yeah.
I get that.
I wish they can change that to see patient, because it's very hard to meet the patient face to face. They still say telephone consultation, so I don't like it. I'd rather see a human. I hope it's going to improve more.
Thank you, that's that. And one more thing. So you said your hearing got affected by the booster or the vaccination?
After the vaccination, for me, I can say vaccination is good. One thing, because for the first time I have COVID. I don't know it's COVID because I was working in the care home. And then I see everybody in one day have isolation, the room closed. So because I'm agency, I cancel all my shift because I scared. After that, while that night I started feeling cold, feeling sick. I understand it's COVID afterward. But when I had the injection, I have COVID for my work. They call me, they say you have COVID. I don't feel that bad. I don't feel that tired. I stay home because I need to stay home. But after my booster, I have neck pain all this round. So that affected me for 3 months.
We're not here last week, so what would you suggest that communication from NHS to us, for you kids especially, to engage you in, being interested? But in COVID or anything else that they put out there?
I think it's like quite an obvious answer, but I think just the easiest thing is social media, because it's such like, it's so widely used by so many people nowadays. I think it's the best way to reach large groups of people and like just obviously convey whatever messages they want to get out.
Mo Salah?
Maybe false information should get censored to prevent like lies being like spread, like maybe certain websites are giving like false impressions of like medical things out at a time should just be like removed, so people are seeing the truth, not just people's.
Sometimes though, it would be out there before they'll know it, and but you can't completely stop that, unfortunately, because of the way social media works. That's a problem. Okay, we'll go to.
Yeah.
What's your name?
I'm Shania.
Okay. We'll come to
I agree with the social media, because obviously like the young people these days, that's kind of where they get all like their news from and stuff. So I feel like there should be like kind of like those adverts that are clear and like precise on how the vaccine works and how we should be getting them. But yeah, I think that's kind of like the most like common way to let the young people know. But also in places where there's a lot of like children, so like schools or like colleges, people could come in, because me like I've been educated about like vaccines, but coming here to learn about the vaccines, I kind of like learned more through like talks like this. So I think people would like appreciate it even more.
So workshops in like groups like this, even with our respective communities, for instance, you can do that. Okay. You want to say?
I would say more community workers who maybe have English but have another language that can get into the communities that aren't there to explain, like that lady down there. Cheaper, it's easier that way.
Okay, yes.
I would say instead of focusing more on like what they are doing, they should focus more on what they're not doing. Like she was saying earlier, like in groups of ethnic minorities, there's a lot less people aware, there's a lot more misinformation, there's a lot less people getting the help that they need. Like statistically, a lot less people are taking the vaccine, and that's probably due to the fear. I think it's important to combat conspiracies going around, but also put as much effort in to like the other side of the things, like the things that you don't really see, because like the white British population within this country are going to get more help and they're going to be more aware of the things that are going on, and I think that the government and the NHS could do a lot more to help those like in the groups of the minorities rather than the majority.
Okay. So what we're actually hearing...
Can I just answer that? So I've spoken with our research teams at the hospital. So they actually have a research hub in Portsmouth based at the John Pound Centre, where people go for the clinical trials, they get injections and all sorts of blood tests. So all that happens, and we have a hub here in Portsmouth that is in a community centre. So one of the things when I spoke to them again is the lack of representation from minority communities. So what I've suggested to them is that they hold open days where we take small groups of people, visit the research hub, what sort of research are they doing, what is the process, what is the pathways, and what that research then can lead to. And I think if we can open up that for community groups to get that understanding and that miscommunication, I think would help with all that, that conspiracy theories as well, that people can see it firsthand for themselves. This is the way things work. So hopefully that's something I'm trying to develop, and I'll come back to you guys to arrange that.
And also another thing that I will state, which is quite obvious, is Airborne as a platform. Because as you know, Shikra, you're part of us, and you know that we've got different community groups, different associations, Cameroon, Malawi, Ghana, Gambia, we're all within this, and therefore using Airborne and the community, we have community leaders meeting every other month. So this is another platform that we can use, and through that we can reach quite a number of people in our respective...
Would you then say it would be better to sort of try and get a clinician here for the 15th of July?
Basically, I would just suggest that, because you've got somebody like that come here, and we've got the community leaders here, who can then pass this on. Can you imagine the reach from just that aspect of it?
And I think that's really important that you've highlighted that, because we need that from the community to be able to go back and say, actually, this is what the community is wanting. They're wanting clinicians to come out, which we can do, but obviously we need a little bit more notice and time to organise that.
Did you want to say something?
I just wanted to add on to what Mo said. I think maybe censorship is not the correct method, because censorship just like breeds what they're saying anyway. By censoring them, you're then feeding what they're trying to say is happening anyway. So I think maybe just giving more information so that people can be like, oh, they have actually provided us with statistics, they have provided us with more information, so that they have no leg to stand on when they're trying to sort of disprove the vaccine. So then like more information, and just across all platforms and across all communities, so that there's no way that they could possibly disagree with it.
I just want to say that I think everything what we're saying is important, but I think we need to talk about the government responsibility as well, because the NHS was honestly completely burnt out, and I think for me what COVID did is to make me realize how important it is to look after the health service as well and the workers, because they did an amazing job. They're not paid enough, and we are putting a lot of responsibility on them, when I think the government really made really bad decisions, because the communication was from the government, it wasn't from the NHS. They were actually working as hard as they can. So I think it's also to put back to the government and say, you made some mistakes and you have to take some responsibility as well.
I couldn't agree with you more. And obviously, I watch the news all the time. Every day I try to watch the news, and from that, there is the inquiry going on at the moment. It's all about apologies, which is not good enough. And can you imagine? Well, I don't want to be political here, but look at what the leaders were doing. They were telling us to meet in sixes and what have you, while they were having parties every night, and then lied about this. To us. So what example are they setting? This is what I mean. I don't want to be political, but it's just it's a fact. And people who are affected, people who have been affected, and obviously you can't even begin to apologize for it.
But with the NHS, what you got was, you either had the government saying that because of COVID, more people had signed up to train as doctors and nurses, or there was a huge amount of doctors, nurses, who had left the NHS. Now, I lost my doctor through the work that he did, my GP through the work that he did through through COVID, he just had enough. So I understand how hard it was, but you never have that constant yes or no. Is it more or less people that signed up? And I think, like Martina says, the government failed the NHS so badly through this. It did.
Right. One more point. I really like the point that you raised around the information, and I think what you're saying, what I heard from your point was that actually we might as a community need more factual information. Sometimes we get one leaflet that's so generic, it doesn't mean anything to the different communities, and it's that inconsistency as well. It's about having a consistent message, but in a way that reflects that community's needs. So some of it may be factual, you know, some communities do want that evidence there, and other communities maybe actually no, I just want a generic, you know, generic information. So I really like that point that you made.
But can we even believe the statistics?
Well, the statistics have to be based on what is there available nationally. It can't be made up. So it's data that's input nationally. So we can only draw from what we have. But again, that point that I said, if we're not involving ourselves,
because they were,
then we'll be,
the reason I said I doubt the statistics is, for someone like me, I'm working as a support worker with young people. It's like the vaccine was imposed on every healthcare worker. Because I didn't want to lose my job, that's why I didn't take the vaccine. Most of my colleagues left the job because they don't want to take the vaccine. I'm like, if I leave my job now at the middle of COVID, I can't have another job.
Yeah, and I think that was another issue.
Yeah, so everything was imposed. Instead of giving out the information, sensitizing the public, the government wasn't doing that. They were instead imposing people to take the vaccine, that if you take the vaccine, you won't have COVID. That's what they put in our heads. You'll be prevented from having COVID. But someone would take the vaccine, after 3 months died of COVID. So they really failed the public. Yeah. They failed everyone.
This is on. Well, they're on trial at the moment, aren't they? Nationally, they're absolutely on trial.
He's just gonna go and sit in his house.
Unfortunately, the one person
is gonna come out of
responsible for it is no longer in there. So.
They're the rich.
But
yeah. Okay. Shall we?
So yeah, I think it's really good. Unless I've got a few things here, I think Kingsley. I don't know if, but we can actually bring all that together, because what we're trying to achieve from this is being part of, research and being part of whatever is being done in the community. Because if we sort of like not doing anything, like being involved in it, it's not going to sort of like improve at all. I think moving forwards is, we're going to try and get a clinician here for the leaders meeting on the 15th of July. And then to see how many leaders can actually take the information and pass it to the respective groups. But also is being part of, the work that's being done by the NHS or NIHR. If they sort of like send us links to sort of like complete all surveys, I think we need to sort of like try and push it to our respective groups so we can be part of it. Because unfortunately, we can't change anything until unless we're part of something.
We need to be part of it. This is what I keep emphasizing all the time. We need to be part of it so our voices can be heard.
Exactly.
So that all our people, all our communities, the more we take part, the better it's going to be for us going forward. Like I mentioned earlier, not just for us, but our children. Our say, will be heard. Our voices will be heard, and it will be marked. It won't be just a tick box. We've gone beyond tick boxes now, where people do, a lot of authorities do tick boxes for the sake of it. And that's partly due to our responsibilities that unfortunately we're not taking care of. But now we've got a voice. Let's put it out there so we can make a change, if it's not for us, for our children in the future.
Right.